Hello guys, myself Dr. Mithil Shah and I welcome you all to my YouTube channel. A lot of DMs, like my DMs are flooded in Instagram after your NEET UG exams have come out. Many people are asking me, they have dropouts and they are thinking to opt for BDS. So should we opt for not? So here's a short video where I will like to help you all how to understand whether you would like to take BDS or not. So what are the aspects that I would like to talk upon over here is whether is BDS a good career option or not. What are the different aspects, like most importantly the financial aspect in the initial phase, in the mid career phase, and after long term, that is after 5 to 10 years when you become a senior dentist after your graduation. And what are the struggles which you will face if you are a first generation dentist, and what are the different things to do if you are an urban person and if you are a rural person, depending upon your locality. What are the pros and cons, and what are the tips from your side? And finally, what kind of a person you are after looking at this video, whether you should opt for it or you're not that kind of a person and you should not opt for it. First thing, introducing you to the BDS is like BDS is like an skill driven and service based career. So it is not a quick money profession if you're looking out of it. In fact, if you will talk about MBBS, BAMS, BHMS, anything, when you want to pursue medicine and when you want to pursue dentistry, anything in your life as a doctor, and especially as a first generation doctor, you need to keep this in mind that everything is skill driven and your service based career. So you should be passionate about healthcare and patient care, then you can definitely enter BDS. You should be willing to work hard and build your name, rather than thinking that I want quick money out of it, I want a job. So you won't get, see, people you are seeing around you are the people who would give exams, complete their exams, get some packages and join some jobs. But this is a different field. Here you have to enhance your skills in the college, give exams, come out. When you come out, you see there are certain things which are different, what you have learned in college and what you have to actually practice on your patients. So then you enhance your skill by being under some mentor. So for first, after coming out maybe 0 to 3 years, I would say you won't be earning much. You would be earning around 10,000 to 30,000 a month under some mentor. So I would advise you to go under some mentor who is experienced, who has built his name for 10 years. You learn from him how to manage a clinic. What are the aspects which you have learned in college? What is different? How is he managing his clinic? How is he talking and communicating? How is he branding himself? How is he marketing? How is he giving his services to the patients? This is what is not taught in colleges, and which this is what is you need to teach as an BDS graduate when you come out. Also, you can do, maybe you can crack government exams and like UPSC, GPSC, and you can have a good chunk of salary and get into government jobs and serve the nation in other way. You can join army dental corps, but for doing that you need to complete your graduation, you need to give your NEET MDS exams, okay, and then you need to give their interviews, you need to clear their physical examination test, and then you get short service commissions and you get recruited there. So these are certain things which you can do. But initially when you start a self practice after coming out, just coming out, not being any under any mentor, things would be unstable for you. So a pro tip for you is that please join under some mentor, please join under him, see how he does things, and it would be very difficult for you otherwise, and it will get easy if you do these things and pursue this thing in your life. So talking about the mid career after your BDS, once you have upgraded yourself, you can join some courses, you can learn about aesthetics, veneers, maybe teeth whitening. These are not taught in colleges, okay? Different type of implants, and you can start practicing those things in your clinic, and you can easily earn around 50,000 to 2 lakh a month. And this will all depend upon how you are marketing, how you build your patient trust, how you have done your communication, your skills, and you will get an upper hand if you are an MDS in any of the clinical fields. You are endodontics, prosthodontics, orthodontics, or periodontics, or maybe oral surgery. So it would be great if you are open to do that as well. After that, maybe after 5 years and 10 years down the lane, when you have become a very senior dentist, you have a very good patient base, and you can easily earn around 3 lakh to maybe 5 lakh or maybe 7 lakh a month. And this will again depend upon how you have built your practice in those 7 years, in those 5 years of your journey, how you have built your patient base, how you have branded yourself, how you have marketed yourself, how you have talked to your patient, how are your skills. So these are the different things which we need to consider. Now talking about the struggles which you will face after coming out as an BDS graduate, which people are not talking about. You know, this phase is frustrating if you are an first generation dentist and आपके घर पे कोई डेंटिस्ट नहीं है, यू आर द फर्स्ट डेंटिस्ट. सो कोई आपको गाइड करने के लिए नहीं रहता है, कोई आपको बताने के लिए नहीं रहता है कि क्या करना है. सो व्हेन यू कम आउट, you struggle as a first generation dentist because you do not have anything family inherited. You do not have your own clinic. If you want to put up a clinic, your minimum amount of investment is around 3.5 to 4 lakh rupees, and it goes up to 10 lakh, 15 lakh depending upon what you are doing in the clinic and which area you are located in. So it is very important, if you are a first generation dentist, to please go under some dentist, learn from him, find a good mentor and learn how he does it, and then you can definitely practice well. Now talking about region where you are staying. So if you are staying maybe in a rural area, so you have an open opportunity and there are not much people around, but cons are that, disadvantages are that patient may be low paying, but pro is that once that patient gets used to it, you have a very loyal patient base. But in cities, what happens, if the patient gets treatment at some cheaper rate somewhere, he will go there, but he will not come to you. He will not understand what is different in this clinic, what is different in that clinic, and you cannot explain that to the patient. But in rural area, you have good opportunities. Government is opening up good opportunities for people. So initially things might not be good, but if you build your patient base nicely, you can do that. I've also seen some good dentists staying in cities, but then maybe coming to weekend into their clinics and working there as well. So during weekdays they are in cities working there in their clinics, and during weekends in rural areas. So that is how you take something from the society and give back to the society. So finally, who can do BDS? Like, how can you select BDS, and how can you know if you are not a person who wants to do BDS? So you are a person, if you want to do BDS, if you are passionate and driven towards patient and dental care, if you are passionate to continuously upgrade your skills, to continuously keep learning, and you have a long-term vision and not short-term vision. You are not meant for BDS if you have a short-term vision, and if you want high money, high-paying jobs out of it, it's not going to happen so soon. And if you are not ready to give those consistent 5 to 10 year effort, build your own name, BDS is not meant for you. Hope this short 9 to 10 minutes videos have cleared a lot. I would love to see you in my DMs on Instagram. My Instagram channel name is Dr. Mithil Shah. So you can definitely reach out anytime to me. Thank you so much. Have a great day.